Now, the 5th of March marked 1 year since the first confirmed case in South Africa. Patient zero was known as a 38-year-old man who had traveled to Italy with his wife. Here's what else we knew. As we get a sense of the information that we knew about patient zero, South Africa's patient zero was a 38-year-old male from Hilton, KwaZulu-Natal, who had traveled to Italy with his wife. Now, they were part of a group of 10 people who traveled to Italy and then came back to South Africa on the 1st of March in 2020. Patient zero has 2 children. And the patient then started self-isolating on the March the 3rd. After more than 14 days of isolation, patient zero was sent home after he had tested negative. Of course, we will continue to get more as we reflect on 1 year since the very first case of COVID-19 was reported in South Africa on the 5th of March. Almost every aspect of life, as we knew it, had to change, and healthcare workers have been at the coalface of the fight against the coronavirus. I'm joined now by Dr. Lehlohonolo Majake, who is a public health expert and hospital manager at Mediclinic. A very good morning to you. Thank you so much for your time. Dr. Majake, let's talk about the impact that the pandemic had on the mental health and the well-being of those in the healthcare, workforce and beyond. Just really, as the news dropped that there was a confirmed case, what were the ripple effects?
A very good morning, Paul. I just want to make it clear, I heard that you mentioned the company I work for, but in this instance, I actually speak in my own capacity, so I'm speaking just as a public health medicine specialist. I think it had a huge impact on the mental health well-being of all of us in the country. But I think as everybody else heard anxiously the announcement made by the president to stay at home and that we'd be locked in level 5. The biggest anxiety we had is, look, we don't know much about this virus, yet we have to go the next day. If everybody else is staying at home, we need to go out the next day, and what's going to happen to us? And I think certainly most of us in management, what we had to start doing is looking at how we're going to mitigate the spread of coronavirus, protect our staff, and also make our healthcare facilities very safe. And of course, that included engaging with a lot of stakeholders, our doctors, our nurses, etc. And one of the sentiments I remember in one of our first COVID-19 preparedness meetings was, what if we're not here in the next 6 months? And I think there certainly was a lot of that. There was a lot of fear, a lot of anxiety, a lot of, am I going to live? Will my family still see me? How am I going to cope? And I think if you look at the stages of grief, the COVID-19 pandemic psychologically brought that about as well. Initially a lot of people were like, maybe it's not that bad. There was a bit of denial. But when it hit and it hit hard, there was a lot of anger. Why me? I signed up to be a medic, but I didn't sign up for that. And then of course with that is a bit of bargaining, a bit of depression. But I must say, a year later, looking back, a lot of us can smile. And I still look at some of the nurses and some of the doctors and I say, remember when we had our very first meeting? And, some of them would be like, let's just pause a bit, let's just wait a bit. I can't think about this anymore. I feel like COVID is all over me. There was a lot of fear.
And how did this then affect you personally, being a health expert and now having to travel from work to home on a day-to-day?
I think the first thing is, from a health perspective, you've got those who look after the entire hospital, such as myself. And the first brief I had with the staff, I literally had to hold back the tears because I was looking at human beings. I was looking at mothers. I was looking at fathers, sisters, people who needed to come to work. They didn't have a choice. It's their daily livelihood for them to put food on the table, and now it's become a risky and a potentially deadly one. So that is tremendously stressful and very strenuous on that basis. And then, of course, it's getting into the COVID wards and looking at them giving the care as well. And you can see that they're having very anxious smiles and anxious body language of calm when they're not really. And of course, again, it was the psychological aspect of when I'm done and I've left the premises, have I really abided to the basic non-pharmaceutical protective measures that will make sure that when I get home, my children and my spouse or whoever it is that you live with will be safe. So it was incredibly difficult. And we all know that we're human beings, so you still have a cough, you still have a bit of a flu, but every time you got it, there'd be great anxiety in the house. And I think that's also another aspect that we also need to look at. We've spoken about the psychological impact of community, psychological impact of healthcare workers, but also the anxiety amongst those who had to be family members looking on their loved ones having to go to work as well. It's huge. It's a massive psychological impact that it has. And I think it's going to be long-lasting. I think we're looking at a country that's going to really need a lot of debriefing, a lot of programs around mental health for a very long time.
And, when it comes to the other elements which could have impacted very deeply on the psychological element of staff and healthcare workers was the misinformation, or perhaps the very little information we heard as we reported the story throughout those early stages, that healthcare workers were saying they don't have enough information and they also don't have access to the PPEs. How was that experience with a lot of uncertainty and not much access to PPEs?
There was a lot of uncertainty, and I think if you're managing and putting your foot down about this is what scientifically has been showed right now, you become the bad boss. And I understood where they were coming from. I mean, I remember I even had my admin department that was supposed to help with some of the access control categorically saying they will not be there. And of course, at a later stage, as the weeks unfolded, they came back and said, we didn't really understand that we wouldn't necessarily have to also look after the patients. But then also, remember at the beginning, there was a huge debate about, is it contact spread, is it airborne, and the expectations that healthcare workers have, both in private and also in public sector as well, where you would see images in China and you would see images in Italy, and the expectation would be everybody has to have a suit, and if we don't have a suit, you're not looking after us. However, when you looked at what WHO was saying scientifically about what the required PPE was, personal protective equipment was, when you were looking after patients who were either persons under investigation but not confirmed COVID versus those who exuded respiratory symptoms versus those who had procedures that will be aerosol generating products. There were different types of categories of what you should don. And I must say, looking back now, it's difficult, Paul. It is incredibly difficult to convince people when they see something outside in the media that what we're doing is good enough. But I think when they look back now, they actually realize that we were spot on. I'm also pleased to really be fortunate to have a healthcare establishment where I didn't have a single loss. Of course, that doesn't mean that other hospitals that had a loss were completely negligent. But I think it also shows the level of scientific efficiency and also the giving of the correct gear that we actually did. But I think like anything in life, when you're in the middle, or the beginning rather, of a pandemic and a crisis, everybody sort of gets it. Emotions are very high. And you have to obviously bring about the maturity component and convince your team. And of course, we opened to discussion. So there were certain things that you would change here and there, like, of course, double masking wasn't really recommended. But if you see that might help your team, particularly those who are the ICUs with very critically ill COVID patients, you adjusted a little bit here and there. But there certainly was misinformation. I think the minister correctly said it about 2 days ago that had he had to do this again, he would really hone into communication. But we've seen it before. We've seen it with HIV as well. We've seen it when ARVs started and how people said these ARVs are going to kill us and they're not here for us, and it's an agenda against Africa. So it happens, I think, across all phases of different types of levels of crisis.
As you speak about the health minister, Dr. Majake, we also know that going back to the psychological impact and those high emotions that you speak of, we know that Health Minister Dr. Zweli Mkhize was saying just yesterday that he has personally had to deal with the different emotions when it comes to not being there to lay loved ones to rest, not being there to perhaps comfort those who may have been ill, speaking about members of his family that were admitted into hospitals. How much of an impact has that had on your very staff, you as frontline workers, having to help and assist others, but not being able to be afforded the opportunity to assist your own family members and be there for your own family members?
It has had a huge impact, Mpho, psychologically. And I think the worst is when you lose a loved one that you couldn't really help at that moment in time because, there was limitations and interprovincial spread. And you think, I've saved 5 other people with COVID and I wasn't even there to see my own. That is the hardest thing, and that's the burden that most healthcare professionals actually hold when they lose loved ones and they think, but this is my bread and butter, this is what I do every single day. So there was that component. But remember, a lot of us also got COVID as well. So psychologically, that is also incredibly scary because when you're the patient, you now cannot not only look after yourself, but you're also worried about the impact of the infection that you have brought into your household and what it would have on your family. So there's also that. But I want to say to you that, and this is also part of just normal governance and management, from the beginning, we actually started having, because you have to anticipate what will come. And of course, we knew the psychological aftermath will come. We've had a lot of debriefing sessions. We teamed up with various stakeholders to come and talk to our staff, etc. Of course, I think one of the greatest frustrations that came with COVID, and this is what we found when we got anonymous feedback from the team that would give us information to see what it is that we could actually change in our health establishment, was a lot of the anxieties were actually not even centered only around COVID, but the economic impact. We had a lot of staff. We had spouses who suddenly lost jobs.
I hate to interrupt you, but unfortunately we're out of time. But I have to ask you this question very quickly. Have you been vaccinated yourself?
Yes, I got vaccinated. I was one of the first people to get the J&J vaccine at Steve Biko. What a great feeling of hope and, you know, a new battery to life that I had. And I think, you know, there were teething problems, but it went well. But I think public sector needs to really also hang on to its private sector. I think there's a lot we need to do in the country, and we need to use all components of it.
Very well. Thank you so much for your time, Dr. Lehlohonolo Majake, who is a public health medicine specialist, giving us a sense of her experiences as we look back at the year that was, looking at the very first case of COVID-19 and the ripple effects thereafter.